attacks the body's immune system, thereby causing it to be susceptible to opportunistic infection. There's no effective cure for HIV, but with proper medical care, people with HIV can live long and healthy lives and protect their partners. How does one know if they have HIV? By getting tested, and by knowing your status, you make healthy life decisions that prevent you from getting or transmitting the disease. The symptoms of HIV vary depending on the stage of the infection. There are 3 stages of HIV. We have the acute stage, the chronic stage, and the acquired immunodeficiency syndrome stage. This is the most severe phase of HIV infection. The CD4 levels drop below 200 cells per mm. The viral load is very high and can be very infectious. People with AIDS are very infectious, and they typically survive up to 3 years. The symptoms of HIV include cough, night sweats, chills, rash, muscle aches, swollen lymph nodes, fever, and sore throats. HIV can be transmitted through bodily fluids like semen, blood, breast milk, rectal fluids, and vaginal fluids. It can be transmitted from persons to persons through vaginal and anal sex, sharing of unsterilized objects such as injections, tattoo equipment. HIV cannot be spread through water, air, or mere physical contact. HIV treatment should begin as soon as possible after the diagnosis of HIV, regardless of the viral load. The main treatment for HIV is the antiretroviral therapy, a combination of daily medications that stop the virus from reproducing.